Hello, this is Pankaj Jindal. I'm a hand surgeon in the city of Pune in the state of Maharashtra in India. Today we will be talking about the base of the first metacarpal and who are the patients who require open reduction internal fixation. If the patient is presenting with a fracture of the base and the fracture cannot be reduced, he requires open reduction internal fixation. If the patient is presented late and the fracture of the base has gone into a malunion, it requires an osteotomy, a reduction, and relocation of the fracture fragment. And again, these are the patients who require open reduction internal fixation. So let's take one clinical example. This patient had a fracture dislocation of the metacarpal 1 base. How do you do it? Since the presentation is late, the patient has already undergone a malunion and this requires an open surgery. Under appropriate anesthesia and a tourniquet, an incision is given at the junction of the palmar skin and the dorsal skin. After dissection of the skin, after the dermal incision, very carefully dissect out the cutaneous sensory nerves, avoid any damage to the sensory nerves, otherwise it forms very sensitive, painful neuroma. So save the nerves. Once you have saved the nerves, you come across the thinner muscles. The thinner muscles are dissected from the metacarpal 1 base and go on the anterior aspect of the metacarpal as you dissect deep to the thinner muscles. Once you have gone onto the deeper aspect of the metacarpal, you immediately see the base of the metacarpal. This is the metacarpal, this is the volar fragment, and this is the trapezium. So once you've been able to dissect out, go deeper down and dissect out the new callus here, and you can see the joint very clearly between the metacarpal and the trapezium. Once you have done this, an important slide here, when you are dissecting, sometimes it becomes extremely difficult, but with the help of the image intensifier, let your 5 to 6 millimeter wide osteotome slide along the palmar aspect of the metacarpal from distal to proximal, and you will be able to delineate the fracture site very easily. You are deep to the thinner muscles. Once you go more and more proximally, you will be able to free up the fracture site. Once you have done this, the fracture is easily seen. You reduce the metacarpal by traction and you will be able to overcome the pull of the abductor pollicis longus. Once you apply an appropriate traction along the length of the metacarpal 1, reduce it and fix it with K wires. The K wires are holding the fracture fragment. The K wires are holding the reduced metacarpal over the trapezium. Once you have done this, you will be able to overcome the malunited distal metacarpal fractures. Other patients who will require open reduction are Rolando fractures, and we'll talk about it separately. Thank you very much.